Good afternoon. Thank you all for being here and for hearing voices like mine today. My name is Ansley Womble.
Hi, my name is Johnny Jones.
Hi, my name is Julia Benker.
I'm Carol Brown.
Pleasure to be with each of you here today.
My name is David Marsteller, and I am a heart transplant recipient.
I am a 7-year survivor of both colon and breast cancer.
I broke my hip and ankle in a serious car accident, and I have a steel plate here and here.
I have been hospitalized 22 times specifically for asthma.
Just after college, I was diagnosed with bipolar, and part of that diagnosis includes psychosis.
A loss in health insurance meant choosing between stopping necessary medication or paying hundreds of dollars out of pocket.
6 years ago, my wife delivered a child prematurely. She spent 142 days in the hospital getting well enough to come home. And even when she reached that point, she still depended on countless prescriptions in order to be able to remain at home and to be able to remain alive.
I myself am a type 1 diabetic, so in order to be able to afford my insulin, in order to be able to afford my regular visits to the endocrinologist, to be able to afford my continuous glucose monitoring devices, it was important that I get a healthcare plan that was affordable for me on the limited income that I had.
The total of my medical care bills, medical bills for that one accident because of the ventilator was $450,000.
The only medication that was found to be effective for this was Latuda, and this medication costs $1,000 a month.
Together with my partner, we were able to make it, but we had to sell our home to downsize and to be closer to St. Luke's where the cardiac center was.
In 2020, more than 45,000 Medicare Part D enrollees right here in New Jersey had out-of-pocket costs that were more than $2,000.
Healthcare, and especially medications, are the majority of my budget. It's bigger than everything. The Inflation Reduction Act, passed by the Democrats, is a game changer.
We are here on behalf of the Inflation Reduction Act that recently passed. It has made some groundbreaking progress and prescription drug reform for seniors on Medicare, and I don't think that enough people even know about this. They really don't.
The Inflation Reduction Act is going to be make such a significant impact on our lives, reducing costs for prescription drugs and insulin prices, capping at $35. That is a game changer.
I was able to find an affordable plan on the health insurance marketplace specifically because of the tax credits that were afforded to me by the Inflation Reduction Act.
This is a real practical step forward for families in North Carolina and across America. And that's what my family wants, and I think that's what everybody else wants as well.
Thankfully, because of the Inflation Reduction Act, the enhanced subsidies that I benefited from have now been extended for another 3 years. I am so grateful that those in similar situations as I found myself will be able to receive these benefits. The relief and peace of mind they provide cannot be overstated.
Can you believe that they're finally going to be able to negotiate Medicare prescriptions, pricing? It's unbelievable. It should have happened years ago.
Now, insurance premiums will be capped at 8.5% of our income, meaning many more working Georgian families can afford health care for the first time.
I'm grateful for that break, because I will be taking anti-rejection drugs daily for the remainder of my life. The Inflation Reduction Act will ease the burdens of these costs of these life-saving drugs for millions of Americans that have paid into Social Security and Medicare during their entire working lives.
Because of their continued support with the IRA, more Granite State families like mine will be able to sleep a little easier at night knowing that healthcare isn't something I have to worry about. Thank you so much for your time.
Thank you, Ansley.